Taher, ICU consultant, electrophysiology consultant at Cairo University. Hello, doctor. How are you?
Hello,
Nice
pleasure
to
to be.
have you today.
Yeah, my pleasure.
As a chairman, what's new in Cairo cardio Alex this year?
The field of cardiac electrophysiology is hugely expanding, and every year you find something new. And cardiacs actually never failed us. It always brings what's new out there and introduce it to Egyptian doctors. And interestingly, the panel of international speakers this year was vast, and we've seen talks, brilliant talks from all over the world, UK, Europe, and USA. Um, the hot topics in electrophysiology are always the VTs and atrial fibrillation, and every year we see new technology, new approaches, and better improvement in outcomes of ablation for atrial fibrillation and VT. And interestingly, and this has been going for a few months, and again there was a brilliant talk this year about new approach or how to improve the outcome of AF ablation. And when the patient is properly selected and when the patient is referred for ablation, actually some tuning, some fine tuning in the procedure, some attention paid to certain details during the procedure can significantly improve. And actually, the publication and the research presented this year is very impressive and actually is promising. And we think we are on the right track towards achieving a very, very successful ablation for atrial fibrillation. VT, on the other hand, is still growing. It's a bit more challenging. The technology is there, but how we use it exactly is still a significant area for research. It is better. Interestingly, many technologies used for these advanced researches are already present in the Egyptian market and are already within the reach of Egyptian doctors, and we have many brilliant Egyptian doctors trained in that field and capable of performing the procedure in a way almost identical to that performed in European and American centers, which is very impressive, I have to say again. So I think it's promising. It is there, and we just need to be aware of it and know when to put it correctly in its place.
Okay, doctor. Electrophysiology in this year, is there any updates, any new topics?
Um, in the field of ablation, yes, there are. Again, we are targeting now not different area, but additional areas in ablation of atrial fibrillation in particular, which are the evidence is showing that these areas, whenever you ablate them, you can get better results and you can save patient subsequent procedure. Maybe instead of offering him one or two or more procedures for AF ablation, you can reduce that to almost one procedure and have a better control for the patient. And again, the technology of using that is already within reach. The one-shot devices have been in the Egyptian market for 1 year. There is ongoing emphasis on the utility and on the success of these devices. We're talking about the cryo balloon, cryo ablation for atrial fibrillation. Again, the evidence is continuous that it produces better results for treatment atrial fibrillation. And in VT, the use of contact force sensing, the pressure sensing catheter, has significantly improved our approach to that procedure. And we can, with this catheter, which is also again present and available in the Egyptian market, whenever you target areas of late potential, delayed evoked potentials, and achieve non-inducibility as an endpoint of your operation using this technique, the outcome becomes much, much better.
Thanks a lot, doctor, to have you here today.
Thank you.